Let's dive into the world of genetic testing for epilepsy. I've been wanting to understand this better, and it looks like we've got some great guides to help us um, from some big names in epilepsy and genetics. It's like we have a cheat sheet for this super complex topic.
Yeah, a cheat sheet's a good way to think about it. We'll be looking at what the International League Against Epilepsy, ILAE, has to say,
Okay,
the National Society of Genetic Counselors, NSGC,
another one.
the National Association of Epilepsy Centers, NAEC, and to get a global perspective, even the German Society for Epileptology, DGFE.
Wow, that is a lot of acronyms.
It is.
But hey, that's what we're here for, right? To break it all down. So where should we begin? What are the big questions that these guidelines are trying to answer?
Well, they're all focused on this crucial question. When is genetic testing recommended for someone with epilepsy? Is it for everyone or just specific cases? And if so, what kind of epilepsy?
Okay, so figuring out who should get tested, that's priority number one. What else is on the agenda?
Once we've got that figured out, we got to tackle what kind of testing should be done. There are different ways to go about it.
All right.
There are targeted gene panels, broader exome sequencing, or even genome sequencing.
Ah, okay.
Each has its own pluses and minuses, so we'll look at those too.
Okay, this is already sounding kind of complicated. I'm guessing these guidelines also talk about how to actually use the genetic information you get, right? Like it's not just about getting the test, it's about using that information, right?
You got it. The goal isn't just a diagnosis.
Right.
It's about making smarter decisions about treatment and care. So we'll explore how these guidelines handle that.
Okay, sounds like we've got a full plate.
Yeah.
Let's dive into that first big question. When is genetic testing actually recommended for someone with epilepsy?
Good place to start. And the interesting thing is there's a lot of agreement across these guidelines. They all say people with certain types of epilepsy should be a top priority for testing.
Okay, so what kind of epilepsy are we talking about?
Well, think about epilepsy that starts early childhood epilepsy. Drug-resistant epilepsy, where the seizures aren't responding well to medication,
Oh, I see.
and syndromic epilepsy, where seizures are part of a bigger syndrome with other symptoms.
So basically cases where it's like more than just seizures or where the usual treatments aren't working.
Exactly. Finding a genetic explanation can be super important in those cases for guiding treatment and understanding the whole picture.
Yeah, that makes sense. But what about people who, don't fall into those categories? Do any of these guidelines recommend like broader testing for more people?
You're asking the right questions. The NSGC, remember the National Society of Genetic Counselors?
Well, yeah.
They actually recommend testing for anyone with what they call unexplained epilepsy.
Unexplained epilepsy. So that's like if doctors can't figure out why the seizures are happening.
Exactly. They believe genetic testing could be helpful even in cases that seem, straightforward at first glance.
Okay, so the NSGC is going for a pretty broad approach. What do the other guidelines say about this?
Well, the NAEC, that's the one focused on epilepsy centers here in the U.S., they also think testing is valuable even when someone's epilepsy is well managed.
Really? Even if someone's seizures are under control with meds?
Yep. They say genetic information can still help assess long-term risks,
Okay.
understanding any other health issues that might go along with epilepsy, and making informed decisions about, let's say, family planning.
Wow, so it's not just about managing seizures now.
Right.
It's also about future risks and making choices down the line.
Yeah, it really shows how genetic testing can add a whole new layer of understanding to a person's epilepsy.
Okay, so we know that genetic testing is recommended for certain types of epilepsy, and maybe even when things seem okay.
Right.
But how do they figure out which test to use? Because I know there's more than one kind.
That's a great question. And that brings us to our next big topic, the different testing strategies out there.
Okay, let's unpack that. What are the options for genetic testing in epilepsy?
Well, we have a couple of main approaches. One is using targeted gene panels. It's like a curated list of genes that are known to be linked to epilepsy.
So like you're specifically looking for certain genetic causes.
Yeah. It can be helpful when there are specific signs that point to a particular genetic syndrome or if resources are tight.
Okay, that makes sense. But I'm guessing there's also a broader approach, right? Something that looks at more.
You're right on. That's where exome sequencing and genome sequencing enter the picture. Think of them as the heavy hitters in genetic testing.
Okay, I'm intrigued. What's the difference between exome and genome sequencing? And why choose one over the other?
Exome sequencing focuses on analyzing the protein coding parts of your genes.
Okay,
That's where most disease-causing variants are found.
I see.
It's super useful when doctors don't have a specific gene in mind.
So it's like, let's check all the usual suspects, but not narrow it down too much yet.
Exactly. And then there's genome sequencing. This is the ultimate genetic deep dive. It analyzes your whole genome, not just those protein coding parts.
Whoa, so it's like leaving no stone unturned. I bet that's way more complex and expensive than the exome sequencing though, right?
Yeah, it is. Genome sequencing gives you a mountain of data and needs specialized people to interpret it. So it's not always the first choice,
Mhm.
but it can be incredibly valuable in certain situations.
Okay, so we have targeted panels for a focused look, exome sequencing for a wider view, and then genome sequencing for the ultimate deep dive.
Yeah.
How do these guidelines help doctors choose which way to go?
That's where things get really interesting. This is where we see some differences in how the guidelines approach things. Some, like the NSGC and NAC, they're all about starting with the broadest approach, like using exome or even genome sequencing as the first test.
Wow, so they really want to cast a wide net right from the beginning.
Exactly. They say we learn more from a broad analysis, and it can be more cost-effective overall compared to doing multiple targeted tests.
Okay, that makes sense. What about the other guidelines? Do they agree?
Well, the ILAE and DGFE are a bit more flexible. They say that sometimes it makes sense to start with a targeted panel,
Okay.
especially if resources are limited or if they suspect a specific syndrome. It's a more tailored approach.
So it's like choosing the right tool for the job, depending on the person and the resources they have.
You got it. This difference reflects the ongoing debates in the field, like how to best use genetic testing technology, cost effectiveness, and how to balance the benefits of a broad search versus a more targeted one.
Wow, this is really fascinating. So there's no one-size-fits-all answer when it comes to genetic testing for epilepsy.
That's right, and that's what makes these guidelines so helpful. They give doctors a framework to think about all these factors and make informed decisions for each patient. But it's not just about the technology. There's another crucial piece of the puzzle we need to talk about:
Roger that.
the human element. These guidelines don't just focus on the science, they also emphasize something called genetic counseling.
Okay, I've heard that term, but I'm not really sure what it means. Can you break that down?
Sure. Genetic counseling is expert guidance during the whole genetic testing process, like having a knowledgeable, supportive guide to help you navigate this complex world.
So it's not just about ordering the test and getting results. It's about having someone to help you understand what those results mean and what choices you have.
Exactly. Genetic counselors are trained to explain complex genetic stuff in plain language.
Okay.
They talk about the possible implications of testing and help you make informed decisions that fit your situation.
That sounds incredibly valuable, especially with all the nuances we've been talking about. Do all the guidelines recommend genetic counseling?
Yep, they all stress how important it is, both before and after testing. They want to make sure people understand what to expect, what the results might mean, and what their options are.
So it's about empowering people, giving them knowledge and a voice in their own health decisions.
Exactly. And it can also provide emotional support, which can be so important when dealing with a complex diagnosis that could change your life.
You know, this is making me realize that genetic testing for epilepsy, it's so much more than just science. It's a deeply personal journey.
I couldn't agree more. But even with the best guidance, there are still challenges, limitations, and potential pitfalls we need to know about.
Oh, like what? Give me the lowdown. What are some of the trickiest parts of genetic testing for epilepsy? Okay, give me the inside scoop. What are some of those tricky parts of genetic testing?
Well, one of the biggest challenges is something we touched on before, those variants of uncertain significance, VUSs, for sure.
Right, the mysterious VUSs. I remember we talked about how sometimes a test finds a change in a gene, but scientists don't actually know yet if that change is harmful. It's like you found a clue, but you don't know if it's actually part of the case, you know?
Exactly. That's a perfect way to describe it. And VUSs can be really hard to deal with because they add like a layer of uncertainty. It can be frustrating for both the person getting the test and their healthcare team.
So what happens when you get a VUS result? Do you just like shrug and say, well, I guess we don't know?
No, not at all. It's important to remember that our knowledge about genetics is always growing. New research is coming out all the time. Databases of genetic variants are constantly being updated. So a VUS today could be reclassified as pathogenic, meaning disease-causing, tomorrow.
So it's like a continuous investigation, always searching for new clues.
Exactly. And that's another reason why genetic counseling is so important. Genetic counselors can help you understand VUSs, deal with the uncertainty, and make decisions about your care. They can also link you up with research studies or trials that could be relevant to your situation.
So they're like your personal advocate in this whole world of genetic testing, making sure you're getting the latest information, the best support.
Absolutely. They bridge that gap between science and what it actually means for a person getting tested.
Okay, so we've talked about the different tests in genetic counseling, but I'm curious, what do these guidelines say about how to use the genetic information you get? Like, how does it actually impact treatment and care?
That's the golden question, isn't it? The whole point of doing this is to make things better for the person.
Right. It's not just about getting a label. It's about using that knowledge to improve their life, right?
Exactly. And these guidelines offer some really helpful insights. For example, genetic testing can help doctors choose the best medication for each person.
Really. Can you give me an example? Like, how would that work?
Sure. Let's say someone has a type of epilepsy caused by a specific genetic variant. There might be research showing that people with that variant respond better to one medication than another. So the doctor can use that info to personalize their treatment plan, make it more likely they'll get their seizures under control.
Wow, so it's like personalized medicine based on your genes.
That's the idea. It can also provide clues about side effects or complications someone might be more likely to have.
So it's not just about finding the right medication. It's also about avoiding ones that could cause problems.
Precisely. It's all about maximizing the benefits and minimizing the risks based on that person's genetic profile.
This is so interesting. It really highlights how powerful this genetic information can be in changing healthcare.
It truly is revolutionary, and it goes beyond medication choices. It can help us understand the long-term prognosis for someone with epilepsy.
Prognosis meaning like what their future might look like in
Yeah.
terms of seizures and their overall health.
Exactly. Some genetic variants are linked to a higher risk of things like developmental delays or intellectual disabilities. Knowing this early can help families get the right support and interventions.
So it's not just about treating seizures, it's about taking care of the whole person.
Right. And it's not just the individual we're talking about here. Genetic testing can also be valuable for their family members.
Oh, how so?
Well, some types of epilepsy run in families. They can be passed down. Genetic testing can help figure out if other family members are at risk and what they can do to take care of themselves.
So it's not just the one person, it's about giving their whole family knowledge and helping them make choices.
Precisely. It's that ripple effect that genetic info can have. It goes beyond the individual.
This is all really valuable, but I have to admit, it also feels a little overwhelming. There's just so much to think about, both the science and the ethical side of it.
Yeah, it can definitely be a lot. That's why it's so crucial to have open and honest conversations with your healthcare providers and genetic counselors. They can help you work through those complex questions and make choices that feel right for you and your family.
It sounds like those conversations are key to making sure genetic testing is used in a responsible and ethical way.
Absolutely. It's about finding the right balance between the power of this genetic information and respecting individual choice and privacy.
Well said. So we've talked about the when, the what, and the how of genetic testing for epilepsy. We've looked at the different tests, genetic counseling, the potential upsides and downsides. But what about the future? What's on the horizon for epilepsy genetics? Are there any breakthroughs or innovations that we should have our eyes on?
Oh, so much is happening in epilepsy genetics. It's a truly exciting time to be in this field. We're on the brink of some major advancements that could totally change how we diagnose, treat, and even prevent epilepsy.
Okay, I'm all ears. What's got you so excited? Spill the beans. What are those breakthroughs that have you so pumped up?
Well, one area that's really promising is polygenic risk scores, PRSs. We've spent a lot of time looking for single genes that cause epilepsy,
Right.
but now we're starting to understand that a lot of cases are actually influenced by multiple genes working together. Each one has a small effect.
So it's not just one culprit. It's like a whole team of tiny clues.
That's a great way to put it. And PRSs let us look at a person's whole genome and calculate their risk for developing epilepsy. It's like a personalized risk assessment based on your DNA.
Wow, that's incredible. So if you know someone has a high risk, could you, step in early and prevent seizures from ever happening?
That's the goal, moving from just reacting to epilepsy to actually preventing it. We're not quite there yet, but PRSs have huge potential for early intervention and personalized medicine.
That's amazing. And it seems like we're on the edge of a whole new chapter in epilepsy care. Any other game changers we should know about?
Oh, absolutely. Another area that's getting a lot of attention is gene therapy. It's a totally different approach where you actually modify a person's genes to fix or compensate for the genetic problem.
Wait, are we talking about, like, editing someone's DNA? That sounds like science fiction.
I know, right? It does sound futuristic. But it's becoming a reality. Gene therapy is still in early stages for epilepsy, but there have already been some promising results in trials for other genetic conditions.
So there's hope that we could one day actually rewrite the genetic code to cure epilepsy.
It's a real possibility. And it's not just about curing epilepsy. Gene therapy could also treat or prevent lots of neurological disorders. Alzheimer's, Parkinson's, you name it.
Wow, that's mind-blowing. Feels like we're entering a whole new era of medicine.
Hmm.
But with all these amazing advances, I wonder what kind of challenges are we facing?
Well, one of the biggest challenges is just how complex the human genome is. There's so much we still don't know about how our genes interact with each other and with the environment. And even when we find a specific gene variant, it's not always clear what the best thing to do is.
So it's not as simple as just finding a gene and fixing it.
Nope. It's more like solving a puzzle where all the pieces affect each other in really complicated ways. And another challenge is making sure these new technologies are available to everyone who needs them. We need to make sure genetic testing and therapies are affordable, fair, and accessible to everyone, no matter where they live or their financial situation.
Right. What good are these breakthroughs if only a few people can benefit from them?
Yeah.
So it sounds like there's a lot of work to do, both on the scientific side and in making sure these advances actually help patients.
Absolutely. But I'm optimistic. We're learning more and more about genetics all the time, and there's more awareness now about the importance of personalized medicine.
Well, this has been an incredible deep dive into the world of genetic testing for epilepsy. We've gone from the basics all the way to the cutting edge. It's clear that this field is changing so fast.
It really is a fascinating field, and remember, knowledge is power. The more we learn about the genetics of epilepsy, the better we can diagnose it, treat it, and hopefully one day find a cure.
I couldn't agree more. And for our listeners, if you're feeling a bit overwhelmed by all this, don't worry. Remember those guidelines we talked about. They're a great resource for patients and their healthcare providers.
That's right. And if you have questions or concerns, reach out to a genetic counselor. They can provide personalized guidance and support.
Great advice. Thanks for joining us on this deep dive into the world of genetic testing for epilepsy. Until next time, keep exploring, keep learning, and keep those brains buzzing.